Hello, my name is Trish Knab. This video is to correlate with the PowerPoint and handouts provided. As a student in the master's degree program, one of the requirements was to develop, initiate, and evaluate a teaching strategy, Practicum. The proposed Practicum chosen involved the use of case studies and simulation scenarios as a teaching strategy in order to determine whether or not they promote critical thinking skills in students. Initially, creating the Practicum as a proposal, the two teaching strategies that were chosen were case studies and simulation. However, in the research stage, it was determined that the addition of concept maps as a teaching strategy would be used to determine if the three teaching strategies correlated together would either hinder or enhance student critical thinking skills. In order to determine how to evaluate critical thinking abilities of students, it was necessary to understand what is meant by critical thinking. Through the research phase, I found that critical thinking has many versions depending on which author is doing the description. For example, the three authors that I looked at in deciphering what was meant by critical thinking skills was over 50 years ago. Dressel and Mayhew described critical thinking as a student's ability to define, sort data, recognize the obvious, formulate a hypothesis, draw a conclusion, and finally have the ability to judge the reality of the hypothesis. Watson and Glaser believe critical thinking is how one's frame of mind works along with one's attitude. It involves a composite of attitudes of inquiry, knowledge of the interferences, abstractions, and generalizations, along with skills in engaging and relating attitudes and knowledge. Sandra DeYoung wrote a book on teaching strategies, and her description of critical thinking, she believes that in order for students to become critical thinking, they need to have the ability to question the unknown, examine underlying assumptions, and recognize the validity of alternative solutions. They have to have the ability to have unbiased judgments that are sensitive to the situation. Students must be able to have an interaction which is reflective, open, and generative. When deciding this teaching strategies to use for this practicum, I had to learn what are the learning styles of students. Students don't learn within the same manner of each other. Some students are auditory learners, which means they learn by hearing. This was accomplished through reading the case studies aloud after students had wrote their answers. These were all discussed with the student educator and the students in class. Some students are tactile learners, which means that they learn by feeling and hearing. A simulation allowed students to auscultate lung sounds, bowel sounds, respiration, palpable pulses, and blood pressures. The kinesthetic student learns by handling equipment for the implementation of care. This was established by providing supplies such as intubation kit for an emergency respiratory distress during the simulation lab. The visual learner is a student who learns by visualization. This was accomplished by setting up the simulation lab to resemble what a patient's room looks like in an acute care setting. The teaching strategies, as stated earlier, that I chose to use to evaluate critical thinking of students that participated are case studies. There were 3 case studies created for presentation to students. Concept maps, although this was chosen later, 3 concept maps were created in correlation with the case studies. And simulation lab. Again, 3 scenarios were created. All 3 of these correlated together. For example, one case study might have covered a patient with a UTI. The concept map covered information with acute renal failure, and the simulation scenario included a patient with pyelonephritis. So although each one of these teaching strategies were different, they were similar in an aspect. And the case studies are a teaching strategy that how it creates a scenario to resemble a patient status. They can be developed as an unfolding case study with patient status changes. When an unfolding case study is used, students must have a higher level of thought process for critical thinking skills in order to decipher which steps they would take in providing care. Students must prioritize decisions through critical thinking skills, and case studies give students the ability to identify individual strengths and weaknesses. Throughout this practicum, the case studies were used in correlation with simulation scenarios along with the concept maps. Students were provided problems that can have multiple outcomes. I believe that case studies engage students to decipher advantages versus disadvantages of providing care, and it teaches students how to solve problems. During the practicum, when case studies were presented to students, they had the option to work independently or collaboratively in a group. When students decide to work collaboratively in a group, they learn how to reflect and discuss the information. As I stated earlier, case studies present a higher level of thinking to guide student responses. I have attached in the handout a copy of a case study that was presented to students during this practicum. Also, following this case study are questions that were asked of the students to determine if they could problem solve throughout the case study. Once students were finished with a case study, they were presented with a concept map, which again they had the option to work together or individually. Once students had completed the concept maps, these were then placed on the blackboard and students individually took turns filling out information. Concept maps, I believe, assist students to see thoughts and reasoning through the connection of cause and effect in order to identify outcomes in order to make clinical judgments. Students are able to see the whole picture between diagnosis, prevention, and nursing interventions with the use of concept maps. Simulation is a teaching strategy used in nursing programs to guide students while learning problem-solving skills, decision-making, and psychomotor skills. Simulation scenario replicates a real-life scenario and allows students to practice without causing harm to an actual patient. Students learn through a simulation scenario skills in the cognitive, affective, and psychomotor domains. In the handouts, I have included a few pictures resembling simulation labs that I experienced through this practicum. The first scene kind of resembles what I saw 10 years ago as a nursing student. 10 years ago, we did not have simulation labs that we could get that in depth with the mannequins. Nowadays, students have the ability to auscultate, palpate, lung sounds, bowel sounds, pulses. They can watch the chest rise in simulation labs. Monitors are available at the bedside, which resembles more a patient room scenario in an acute setting. Students can view the monitors and see respirations, heart rate, information on the mannequin. In the simulation labs nowadays, students are able to have experience with IV starting central lines, multiple IV access. Educators can set up the simulation labs to replicate a patient's room in real life in order for students to connect patient care and responses. Some universities have updated their simulation labs with computerized data. One area is the instructor or the facilitator is able to change respirations, heart rate, temperature on screens in order for students to see actual changes and decide which steps to take during care. The 3 personal learning objectives that I had decided for this practicum was that the student educator, which is myself, would provide students with 3 case studies to use in correlation with a simulation scenario. These case studies will have high-level thinking questions that are open-ended. Open-ended questions bring students to discuss more versus a yes or no answer. The second personal learning objective that I chose was that I, along with my chosen preceptor, would evaluate student skills for patient care during simulation scenarios. This was completed throughout each simulation scenario as students role played through each scenario presented to them. The third personal learning objective is that I would evaluate the use of case studies with simulation scenarios by reviewing evaluation reports from students to determine effectiveness or failure of projected proposal. The learning activities included that students were presented with a case study and a concept map for completion. The case studies were discussed with the student educator and the students. The concept maps were completed on the blackboard with each student completing a section. After the completion of the case study and the concept map, students were then divided into groups and participated in the simulation scenarios, which all 3 of the teaching strategies correlated with similar diagnosis. As stated earlier, for example, the case study was a UTI, concept map covered acute renal failure, and the simulation covered pyelonephritis. At the completion of the simulation scenarios, the nurse educator, which is myself, and the students participated in a debriefing session. This routine was completed for 3 days, and evaluations were completed after each day by the students. Of course, I completed my evaluation of how I felt students did day 1 to beginning to the end. On the final day of the practicum, I compiled the data and results of the evaluations completed by the students. During the concept map and case study evaluations, this was completed through summative evaluation and completed at the end of the day. Formative evaluation was completed during the simulation scenarios while students were performing skills. I provided a sample of the evaluation given to students at the end of each day with questions as far as was determining whether they felt the combination of case studies, concept maps, and were helpful in their performance in simulation scenarios, and why or why not they didn't feel that way. Again, they were provided 4 questions at the end of the day to decipher whether the combination of these teaching strategies was effective in promoting critical thinking skills or if it hindered. In the final analysis, in review of all the data collected, it is noted that the use of the 3 teaching strategies has been effective in assisting students to build and use critical thinking skills. I had the opportunity to interact, teach, and monitor each student during the practicum. I was able to watch students interact and participate throughout the completion of the teaching strategies provided. The students have made improvements in how they think in any given patient situation. The students started the project unsure of decisions they made during the simulation scenario in the beginning, and by the end of the last day, they were able to recognize and prioritize interventions based on the status change of the patient. Students showed improvement in the delegation of tasks to each member of the team, providing education to family members of pediatric patients, and anticipating what a physician may order dependent on the patient diagnosis. By the third simulation scenario, students were asking more questions to determine which action would be appropriate to provide patient care. The students state they felt more confident in how they made decisions in order to implement the care provided to the patient in the simulation lab. Each student focused on the detail of the patient's status and assessment. For example, the students were able to demonstrate what nursing actions would be when receiving inaccurate or incomplete orders. One area in which students seemed to have some difficulty with involved medication calculations for administrations to the pediatric patient. The students felt that this task was difficult for them and noted their anxiety levels had increased as the calculations were time-consuming. Students felt unsure of which medication should be administered first and take priority in regards to the physician orders provided. Based on the data collection, this combination of teaching strategies has shown that students do indeed improve on their critical thinking skills. Students felt that the more they interacted, the more they practiced, the more they understood. Areas of changes to the curriculum were updated throughout the initiation stage. One area that was updated from the original practicum proposed was that the addition of concept maps was added after case studies. How the concept maps were presented was changed daily. Another change was role play was added to the simulation scenarios for students to gain knowledge of responsibility in each role. For the student educator's experience, which would be my experience, creating, initiating, and evaluating the practicum allowed an insight on what the whole aspect of being a nurse educator really entails. Being a nurse educator is not just teaching subject information to students. To be a successful educator, one must bring to the table more than just providing subject information to teach. Nursing educators spend much time in order to ensure he or she is prepared for the course to be taught, researching evidence-based practices, evaluation of coursework, and ensuring students are learning in every domain necessary to be successful in the profession. Being a nurse educator means you're a mentor. You are the vision of what nursing is. Throughout the practicum, I was able to not only present case studies, concept maps, and simulation scenarios in order for students to complete, I also had the privilege to get to see how each learning style is portrayed with teaching strategies. Students provided their perception of how the teaching strategies were presented and what changes they would prefer to see that would benefit their learning style. Working closely with the on-site preceptor through guidance and support, this gave me the confidence in my ability to present the teaching strategies to the students. Building a trust relationship with students is a must. Students must feel the educator has the knowledge in the subject that is being taught. Throughout the practicum, 3 journals were required for the evaluation of the practicum and initiated the monitoring and evaluating of success and needs for improvement thought by myself throughout the initiation and evaluation process. These journals made me focus on the areas that I felt needed work and areas that I felt I was able to excel in. During the initiation and evaluation of the practicum, I was able to build on my communication skills with not only the preceptor but also the students. I was comfortable with my preceptor and had the opportunity to discuss ideas and rough draft case studies in order to be presented to the students. Although I was nervous, my preceptor made it more comfortable to present the teaching strategies to my students. By the last day, I felt comfortable with the students and the teaching strategies I was presenting. As with recognizing the areas of strength, I also recognized the areas of which I felt weaker. These areas include my understanding that not all students learn in the same manner. Correlating teaching strategies to focus on the diversity of the students. During the presentation process, I had to realize that when presenting to students with the chosen teaching strategies, the question levels are not the same for all students. For example, I learned to create a higher level question at the master's level. Students that participated in the practicum are BSN students and not at the level I may be at. That concludes my overall experience with the final steps of obtaining my master's degree in nursing education. Thank you.